My presentation will be on botulism. Its infectious agent is Clostridium botulinum, domain bacteria, division Firmicutes, class Clostridia, order Clostridialis, family Clostridiaceae, genus Clostridium. It is a spore-forming, gram-positive bacillus bacteria. C. botulinum was first identified by von Ermengarten in 1897. It produces toxins. Different strains of it produce any number of the 7 different toxins labeled A through G. On this picture here, you can see the bulging spores on the end of the bacillus bacteria. For pathogenesis, C. botulinum is non-invasive and it's not transmitted between people. It's either consumed through food or it's introduced through a wound. Generally not a wound. You usually eat something that has C. botulinum in it. It then enters the bloodstream and is carried by the lymphatic system to your neuromuscular endings. It produces botulinum toxins, of which there are several types, but the one people are generally concerned with is botulinum toxin A. It produces them in anaerobic environments, and then those toxins bind to your acetylcholine receptors on neuromuscular junctions. This leads to flaccid paralysis, where you just can't move. You're not tensed up or anything. You're just limp. It goes proximal to distal. It starts from your head, your cranial nerves, and goes down your body. This can lead to respiratory failure, which is why it's dangerous. There are different types of botulism based on how you get it. Foodborne, you generally get it from canned foods. In an anaerobic environment. Infant botulism is from age 2 to 8 months, generally consumed through foods, honey. Other sources aren't known. Wound botulism, open cuts have been recorded, but it's generally needle sticks, unsanitary, or whatever you're sticking into yourself. Adult infectious, when you consume foods that have it in small quantities and you have a compromised immune system. And inadvertent is an overdose of treatment, botulinum A, so Botox. So for infant botulism, generally the first thing you're going to see is constipation and progressive weakness, poor feeding, diminished crying and ventilatory distress. This will happen over the course of a few weeks. You'll see symmetrical descending paralysis, and then 15% of cases can be traced to the consumption of honey. Foodborne botulism is generally what you see in adults. Symptoms show 18 to 36 hours after exposure because the bacteria is in an anaerobic environment, the canned foods, and is already producing the toxin, so your system is immediately hit with it. Initially, you're going to see nausea, vomiting, abdominal cramping. If you suspect botulism, within the first hour or so, you can induce vomiting with Ipecac. Next, you're going to get dried mouth, blurred vision, diplopia, which is double vision, and then you'll get hoarseness, difficulty speaking, swallowing, and then peripheral muscle weakness. So basically, if it's your muscles, they stop working, you'll get symmetric descending paralysis, and you're at risk from eating home canned foods that are not well prepared. If you want to kill all the endospores, you need to either heat your food at 30 minutes, for 30 minutes at 80 degrees Celsius or 10 minutes at 100 degrees Celsius. So it has to be pretty hot. For wound botulism, you'll see, because it's introduced through the bloodstream, you're going to see lesions on the skin, dried mouth, blurred vision, diplopia, hoarseness, difficulty speaking, etc., etc. Symmetric descending paralysis. Again, it's possible to get botulism from open wounds, but you're going to get it from drug use generally, especially black tar heroin. Don't do drugs, kids. Symptoms usually take 4 to 10 days because you're introducing the bacteria from a non-anaerobic environment, an aerobic environment where they're not producing the toxin. And then adult infectious botulism, you're going to see this again, the same symptoms. It can look like Guillain-Barre syndrome because you don't have the nausea and vomiting. Adults are at risk if they've had abdominal surgery, if they have Crohn's disease, which is autoimmune disorder, or they've had recent antibiotic treatment. And then inadvertent botulism is pretty rare because it occurs in a clinical setting. You're going to see heartbeat irregularity, and you're going to see descending muscle weakness and paralysis. You're at risk if you regularly get intramuscular injections of botulinum toxin. You need a very big dose for this to happen, and it doesn't happen a lot. So the intramuscular injections are used for movement disorders and then Botox treatments. For diagnosis, you can observe all the symptoms, and then in addition to that, you're going to need to isolate the bacilli bacteria, so you can do gram staining, and you can see the spores on the bacilli from the slide I showed above. You can also do blood agar plates or RCM broth. What you really need is toxin demonstration, so you'll get this from stool, stomach, small intestine, or the food that was consumed. Generally, you're going to see mouse inoculations where they inject the mice with the serum that's produced from the stool or stomach or whatever. And then the mouse will show paralysis within 48 hours. Enzyme-linked immunosorbent assays and electrochemiluminescent tests are in the process, but they're not yet approved, and you're not really going to see them. For treatment, you're going to have ventilatory support if they need it. You're going to administer the antitoxin, which only helps so much, and you want to do it as soon as possible because it won't bind to the toxin that's already bound to the acetylcholine receptors. Only if they're free will it stop them, so it'll provide some relief but not make it go away. And then you just provide general support for the duration of the paralysis, and the immune system will take care of the rest. You don't want to use antibiotics because cell lysis increases the amount of toxin in the body. You're killing the cells, and you're just releasing all of that toxin. So botulism and Botox. Botox is the patented name of the treatment where you inject botulinum toxin A. So it's literally just the toxin in a small amount. You get the Botox treatments are the injections of the botulinum toxin in specific areas, and it reduces wrinkling because it's flaccid paralyzation of the muscles. It takes a week or so to have a visible effect, and then it lasts for 3 to 4 months. Other uses for botulinum toxin, it can be used to treat spastic muscular conditions, and because it's very effective at paralysis, it is a bioterrorism threat. And these are my sources.